Subject Chair here at NCFE for Education and Early Years. I'm here also tonight with my colleague Gemma McGregor, who's the Provider Development Officer who offers a quality assurance and development to all of our customers across various quals. So welcome to Gemma.
Hi Angie, thanks for having me.
Pleasure. I can also see that we've been joined by Janet King, who's in the process of travelling to London tonight. Janet King is our Sector Manager for Education and Early Years. So brilliant to have you on board here, Janet. So she might be in and out, depending on where the train is.
Yes, fingers crossed, but great to be here. Thanks, Ange.
Lovely, thank you. And our guest speaker and our resident subject chair for health and science, Peter, who will be introducing himself in just a moment when he begins his presentation on fetal alcohol syndrome. So welcome to our colleagues. And I can see that there are other NCFE colleagues joining us tonight. So welcome to you all. So just want to say that this is a really relaxed event and we are openly encouraging you to use the chat box or the reaction button to ask any questions or perhaps express your thoughts. So please feel free to do so. Gemma and myself will be keeping a close eye on the chat box throughout Peter's presentation. So before I hand over to Peter, I just wanted to say a few words regarding the value of these sessions in creating an awareness of children, young people's needs, and how we as practitioners, educators, specialists, professionals, because there's a whole range of different people that dip into these events, how we may be able to support these children and young people as they journey through life. As you're all aware that there has been a recent SEND reform, which has outlined 5 key principles. And the very first is early. Now, early in terms of providing support as early as possible. Now, we're all aware of the importance of early intervention, right? But we also know that it's about recognizing that need, having an awareness of those needs and perhaps even how to support those needs or where to seek that specialist advice and guidance to be able to support not only the child or young person but their families. And these are often the stumbling blocks that we face. And I'm sure, I know I could, and I'm sure you could, we could all talk about experiences that we have had, either in the setting or our own personal experiences of those stumbling blocks. And that can prevent that child from progressing. It can create challenges for that child as they develop through their journey of life. But on a positive, the reform has outlined future investments towards boosting funding to help overcome these barriers. However, as we know, these take time. So it's important to remember we all play a part in taking responsibility in supporting these children, young people and their families. So I hope this session today is going to help towards increasing your awareness of need. I know it's going to increase mine for sure. And remember, a little quirky thing here, remember that from tiny little acorns grow mighty oaks. So without further ado and delay, I'm going to hand over to Peter. So Peter, the floor is yours.
Thank you, Angie. And also thank you, Angie and Janet and Gemma for organizing these events and having me. So, as said before, my name is Dr. Peter Johan Kruithof, but that's a whole lot of words, so just call me Peter. It's easy enough. I currently work at NCFE as a subject chair, health and science at NCFE. And before this, I studied at different universities and colleges and other educational settings around the world. I've done my PhD on alcohol-related brain damage and the treatment pathways to diagnosis in the Northeast. Some of you I can see are as well from Sunderland College, where I worked until recently, so you may have seen me on campus there. Okay. What are we going to discuss today? We'll go through all of these topics. There's a chance that we will focus on one topic more than another, But at the end, there's also room for questions, and also throughout, if you have questions or any comments, please type them in the chat or in the Q&A function that should be up there as well. So we're going to start with what is fetal alcohol syndrome. But before that, we're going to start. I have also done research on the topic of alcohol-related brain damage in Siberia, in Russia. So I was there for a few months in the city of Tomsk, and there I looked onto the topic of alcohol-related brain damage and the kind of care people would get. And one thing I discovered was quite interesting is that during the Soviet Union times, there were loads of campaigns to try and prevent people from consuming alcohol. Not very successful in most cases, but the posters were interesting. So every now and then in this presentation, you will see posters like this popping up. So this is a poster and it says in Russian, "Нет," meaning no or not. This is one of the posters that the Soviet Union created in an attempt to get people to stop drinking. So what is FAS or FASD? So you can see the difference here, a fetal or a futal. The second one is the English spelling and the other one is the American spelling. You have a fetal alcohol syndrome. That is the official diagnosis. That's the diagnosis you can find in the ICD-10 and 11, and this is what people actually get a diagnosis of. However, these diagnoses are quite hard to do, and sometimes you will see children that do not have all the hallmarks of people with fetal alcohol syndrome, and as a result, they aren't able to diagnose them fully as having fetal alcohol syndrome, and then they might get a diagnosis of fetal alcohol spectrum disorder. All damages caused by prenatal alcohol exposure, which are not diagnosed as fetal alcohol syndrome. It's therefore also often seen as an umbrella term. Then above that umbrella term, there's alcohol-related brain damage. Diseases as fetal alcohol syndrome can fall underneath this, but also Korsakoff syndrome and Wernicke encephalitis, which despite being mainly due to a result of lack of vitamin B1, also is often caused by the use of alcohol. Right, you can also see at the bottom there are some references to articles I've published. There will be other references throughout the slides, and after a while some of the slides, they got so many references that I ended up putting them at the last slide, so be sure to check them out. So, I see a thumbs up, so that's good. I can see here, and hopefully you guys as well, an overview of the different developmental stages of first the zygote, then the embryo, and finally the fetus. Here you can see how which bit develops and how long it develops. So you can see here the ears. You can see that it starts to develop in the 4th week and continues to develop until the 16th week. Also, by the way, English is my second language, so if you hear an accent or a slip up, I'm just going to blame that. You can also see that external genitalia, they start to develop in the 7th week and will continue to develop to the end of pregnancy. So similarly, you can see teeth and a palate developing. And here you can see as well how, for instance, the heart develops during the 3rd week. Of course, the heart is very important in the early stages and later on, of course, as well. So the heart allows the blood to be pumped around the body. So it's very important to deal with that at the beginning of the development of the fetus and of the embryo. And it continues to do so until the end of the 8th week. Now, these are all important topics, but then, lovely. I see somebody had a message. That's lovely. And
yeah, we'll keep an eye on that.
Peter, okay, sorry for getting distracted.
That's okay.
Okay, so now you can see here loads of different elements and when they develop, but we're talking about fetal alcohol syndrome. So if you talk about fetal alcohol syndrome, it often discusses the central nervous system. So when do you think the central nervous system starts to develop, and how long does it take during during pregnancy? Anybody, any idea?
No response so far there,
No
Peter.
response. That's fine.
We don't want to get it wrong.
There's no wrong answers, but it is just to point out that it's a long time. It starts in the 3rd week. So basically as soon as people start to, there's microphones on, can they be muted? The 3rd week of the 1st trimester, that's already when the central nervous system starts to develop. And that's a very important thing, because the central nervous system has to send all the signal from the brain and the spine throughout the body. So that continuously develops throughout the entire pregnancy, starting from the 3rd week. So you can understand that there is no clear moment when alcohol can be used without causing damage. Now, here another one. The Russian says exchanged, in this case, the alcohol for the baby. It is one of the quite grim pictures to help prevent people to start drinking alcohol and focus more on home life. Yeah. Now we're gonna look here and a big table. This is a table with all possible features, physical features of fetal alcohol syndrome. We're not going to go through all of these, but these can be found also in articles that I've published. But important to note are 2 things. First of all, not all physical symptoms are always present. So some children with fetal alcohol syndrome and even adults might not display some of these features anymore due to growing up and changing morphology. Another note is that these physical symptoms alone are not a firm diagnosis of fetal alcohol syndrome. Because, for instance, you can see here folds in the upper eyelids, and a small opening between the eyelids is seen as one of the features. However, if you're from a different ethnicity, this might be part of your ethnic heritage. Similarly, there are also other diseases that have similar features. Now you can see in the images here, a smaller head is often a feature, a small opening between the eyelids, a railroad track ears, we're going to talk about it later on, a lower nasal bridge, so on the top of your nose, instead of that it goes up or it goes straight, it tends to go more flat alongside of the face itself. Similarly, you can see as well a slightly upturned nose, a flat middle face, so the cheekbones are less pronounced and it seems to go just straight downwards. The lips we're going to show in a second as well. Another thing here, you can see campodactyly in the hand below, meaning that one or more joints in the fingers can be stuck or slightly bent constantly, and not as a result of trauma, but this is how they are born. There's also a lot of structural problems within the central nervous system. Sometimes this can be even not just damage, but even a complete absence of an important part, which is the corpus callosum. So you probably know that the brain consists of multiple parts, but it's often talk about a left and a right brain half of the brain. So these are all connected with the corpus callosum. And that's a line of nerves that allows communication between the 2 brain halves. Due to a large amount of alcohol exposure in the uterus, so that's prenatal alcohol exposure, that corpus callosum can be not just damaged, but even completely disappear. And as a result, there is structural damage that cannot be overcome. And they will have difficulty coordinating with the hands as a result. They have difficulty planning for things. We're going to talk about that in a bit further. So another sign that is often talked about is the lips. So you can see here in this image, you can see two different ethnicities. You see a child who is from an African, so children who are from an African heritage and children who are from a more European heritage. And it's because the lips, how they look, is different per ethnicity. So you can see here on the top two, number 5 and number 4, these are cases where fetal alcohol syndrome has been diagnosed. You can see a very thin upper lip and lack of a cupid's bow, and also they lack a philtrum. So the philtrum is basically the lines that go from your nose to the top of your lip. They tend to be flatter. You can see an ear as well. And I'm going to point here at the ear. You can see here how the ear seems to overhang a bit. This is considered to be also part of it because the ear is not fully developed. Another thing you can see here is how normally in your ear, if you have this line following here, it goes slightly downwards and then dissipates into the ear shell. However, with people with fetal alcohol syndrome, this line continuously stays there and starts to have a clear line with the line above, and that's why it's known as railroad track ears. So railroad ears. So basically lines straight on in the ear shell. Another thing you can see here in this image at the bottom is hockey stick crease. So if you look at your hand, your own hand, you can see how the middle line here goes normally straight. And then tends to disappear here. Children with fetal alcohol syndrome sometimes have a line that looks like a hockey stick and goes between here. It seems to be in quick curve upwards. So now I'm going to talk about something that will be a bit complicated. It's called epigenetics. And it sounds very complicated, but we're going to keep it simple. So epigenetics is changes, alterations in your DNA or your RNA through outside means. So how cells can appear the same, but the DNA in it can be changed to, for instance, exposure to alcohol or radiation or other things. In this case, we're going to talk about alcohol. So alcohol can change the way that your DNA works and how it expresses itself, mainly in your hippocampus, so in the back of your brain, and your neural stem cells. So you probably have heard of stem cells, and stem cells are basically blank cells that can change into other cells. Neuro stem cells can change into neurons. However, the DNA in these stem cells, they can be altered, meaning that if whatever damage happens at the beginning continues to occur because the stem cells think they need to create a broken system and continuously make the same broken system. So if we talked about earlier how the brain might not develop their corpus callosum, the communication bit between the two brain halves, that cannot be fixed and that cannot be overcome because in the DNA it is changed so that your brain thinks, so that the cells think, this is how it should be and this is how we need to maintain it. Alcohol can also not only alter the person itself, but it can also alter the germ cells. And germ cells meaning sperm cells and egg cells, which means that alcohol exposure can not only have impact on the child, but also future children they might have. So that is what epigenetics is, and this is how dangerous alcohol can be. So another poster with from the later period of the Soviet Union, and it says Papa Nie. Napier, something like that, that don't drink. So you might have realized that there doesn't seem to be, this isn't a topic that's often discussed, and that is a problem. And the reason why is that there is problems with diagnosis. First of all, it's rarely diagnosed at birth because it requires you to know that a person has consumed alcohol before during pregnancy. There's no specific diagnostic test. Also, there's underreporting of the amount of alcohol that the mother drinks, because you will often not want to admit that you've been drinking. But there's also sometimes confounding factors, meaning that other factors can cause and contribute to fetal alcohol syndrome. For instance, the poor nutritional status of the mother, or they might use other drugs as well. When a baby is born, it can be hard to tell if a child has fetal alcohol syndrome in some cases. For instance, what I mentioned about the nose being turned slightly up and have a lower nose bridge, these kind of things develop more over the years that the child grows up. Other things, poorly defined diagnostic criteria. So again, there is not a clear set of rules that if a child has these items, the child has fetal alcohol syndrome or fetal alcohol spectrum disorder. There's also a lack of specific teams that can do the diagnosis. There's also a lack of knowledge and understanding amongst of many fetal alcohol spectrum disorders amongst health professionals, make them not feel competent enough to make a diagnosis. And like I said before, there's also diseases that have similar features, such as Williams syndrome and DiGeorge syndrome. Knowing all these problems with diagnosis, how many people have fetal alcohol syndrome or fetal alcohol spectrum disorder? Well, any guesses how many would be in the UK? Talk about percentages. Feel free to type it in the chat.
Would it be thousands, Peter?
It would be more than that.
40%,
well,
Melissa says. 20%, Vicky.
Okay. It's
Yvonne, 40.
Yeah, it sounds like a lot. And you seem to be close in some cases. So it differs per research. There hasn't been a conclusive result of how many cases. Wise found 3.2%. May and McQuire differs between 16 and 17%. Scholing basically says, well, you can't really have a reliable estimate because of all the problems with diagnosis, and that is often underreported. However, you can decide about the amount of alcohol people use during pregnancy to make an estimation. The Office for the National Statistics in 2018 identified that in 2017, 11.3% of the interviewed pregnant women admitted to having drunk alcohol in the previous week. However, Nikar et al. Did research in Leeds among 1,300 pregnant women aged 18 to 45 years old, and 79% of the women in the study admitted to having drunk alcohol in the first trimester, 63% in the second, and 49% in the third. So if you take all these numbers and amount of alcohol women are drinking during pregnancy, you can imagine that the actual amount will be far higher than the suggested 3.2%. And that's why, for instance, often people focus on the fetal alcohol syndrome, which is the diagnosed element. However, you can also look at fetal alcohol spectrum disorder as the problems more people have around that is not yet diagnosed, but do have some of the features. So I can see, for instance, Yvonne, I think 40%, Melissa White also mentioned 40%. That is not a bad suggestion how many it can actually be. And there's often also social problems because it's seen as, oh, well, one can't hurt. But if you saw earlier how important the neurological development of the fetus is, constantly it will continue. Furthermore, there's also issues here that in the first trimester, you can still imagine a woman might not be aware that they are pregnant. So they might be still drinking. However, still drinking in the second and the third trimester and being unaware is less likely. Here, another poster from the Soviet Union days, but my mother doesn't love me. It says in Russian on the top. So what kind of impact? We saw physical impact. Now we're going to talk more about the social, cultural impact of the child. Know that not every child will experience the same level impact. Rachel Hopper has a good question. Could I please ask what age do children generally get a diagnosis? So children tend to get a diagnosis around the age of 3, 4, depending as well how many care professionals are aware. If it is a case where that's the problem, they often don't get a diagnosis to start with. But when more the things become more apparent, so they don't meet the certain benchmarks that a child normally meets throughout their life, they might start to get a diagnosis and physical features become more apparent. But again, it is difficult to see. And if there's no GP aware of the situation or able to diagnose, or there's no social worker involved, or the social worker is not aware of the condition, it can just go by and nobody gets a diagnosis. You're welcome. Elizabeth Scott, I'm interested in Korsakoff. Me too. As I mentioned, I did my PhD on it. Happy to talk about it as well in later time. Now, they will also have, the children will have problems with learning and remembering. You can understand why, because they're damaged actually in their brain. Certain aspects of learning and remembering is something they might struggle with. As a result, they might not be able to learn new behavior. So they might need to, instead of learning new behavior, they might need to grind in a pattern. Structure is very important. They might struggle with understanding and following directions, controlling emotions, because the brain damage is not just in the center, but also might be in the frontal lobes. As a result, also communicating and socializing, daily life skills such as feeding and bathing. It depends on how extensive the damage is. So you have children who you could see from their appearance but still manage okay. But you also have children who are thus severely impacted that they cannot take care of themselves when they grow up. They often all suffer from impulsivity and hyperactivity. That's one of the reasons why it's often misdiagnosed as having ADHD, because they're very impulsive and very hyperactive. The thing is, with ADHD diagnosis, those children with ADHD could benefit from the medication. Children with fetal alcohol syndrome often can't, because their brain is simply damaged, so they can't see the benefit, get the same benefit of the Ritalin, for instance. But because of they are so impulsive, they are also increased susceptible to victimization and involvement in the criminal justice system. These children are often easily lured into making bad decisions. When a person with nefarious ideas and intentions comes to them and they say, well, you know what you should do? Let's go rob a bank. And they think, oh well, let's try that. Because they are very impulsive and they are easily swayed. maybe robbing a bank is not the thing they always do, but you can understand other issues as well. So this is a study that's conducted in Sweden, and they compared 79 people with fetal alcohol syndrome and at age 32, and compared them with 3,160 people without fetal alcohol syndrome. 25% of the people with fetal alcohol syndrome at age 32 has received special education versus 2% of the general cohort. Unemployed, 51% was unemployed versus 15% of the general population. 31% received a disability pension and 3% only from the general population. Hospital admission rates for alcohol abuse are also quite significantly higher. So people with fetal alcohol syndrome are also more likely to develop problems with alcohol themselves as well. They were more likely as well to have a diagnosis of a psychiatric disorder. So they are because of also damage to the brain, and combine that with trauma in the early childhood as well. And more likely as well to be prescribed psychotropic drugs. I see a question from Fiona. What would happen if a person was misdiagnosed and did take the medicine for ADHD? What impact would it have on a person who instead has a fetal alcohol spectrum disorder? So, where with ADHD, the medication is often an upper. It is a medication that in the general population would make you very energetic, and they will in a person with ADHD, with getting Ritalin, for instance, they will feel very hyperactive and very focused. Whereas people with ADHD, medication will allow them to actually settle down. Whereas with people with fetal alcohol syndrome, it actually just damages the brain further. And they will not feel restful and calm. They will still remain very hyperactive as a result. Right. Impact on the individual as well. This is also a German study found that 1 in 4 patients had no friendships. And if they had friendship, you're welcome, Fiona, it was only sociable. There's often a lack of a reciprocal friendship, meaning that it is not just giving or not just taking. It should be vice versa, as a regular friendship would be. But in most friendships, it tends to be the ones who are giving a lot without getting anything in return, or they would lack social skills and would just want to take rather than reciprocate. That is traumatic in itself, Peter. Yeah, it is. Growing up without any friends, it is very hard. And patients are often talked into things and as a result are exploited or otherwise treated to their disadvantage. Even as adults, patients with fetal alcohol spectrum, alcohol syndrome, sorry, I keep on mixing them sometimes up, are naive and easily influenced. Aggressiveness seems to be the most common emotional disorder in men with fetal alcohol syndrome, and becoming manifest as tantrums and originate from stress and overstrain. So aggressiveness, and you can imagine if a child is not diagnosed with fetal alcohol syndrome and they become an adult, and an adult man becoming having a tantrum that normally a toddler would have and become aggressive as a result, it becomes way more intimidating and seen as just a person that needs to be in incarceration rather than a person that actually just needed care for a long time. Also, in many older studies, issues with inappropriate sexual behavior is often mentioned. However, a decrease is seen in cases where there's more structural support. So in many cases of the older studies, children who were diagnosed with fetal alcohol syndrome often would remain with their families. where they would often be further traumatized and not guided when they had developed during puberty and not knowing what they needed to do with those hormones and feelings. And they would often, as a result, show inappropriate sexual behavior. But with extended support, that does decrease. But on the other side, people with fetal alcohol syndrome are also more likely to be the victim of exploitation and abuse, as they are often, as I mentioned before, easily manipulated and seduced. Not a drop. We talked about the data before, but US data suggests that the rate of fetal alcohol spectrum disorder are higher than those of autistic spectrum disorder. Yet there's far more support available for children with autistic spectrum disorder. And that's ridiculous. I think one of the reasons why is because alcohol is still a issue where people have a lot of shame for, and there's taboo on it, and people talk about guilt a lot because, well, they are find it often very easy to point out, well, the mother is at fault, she has been drinking, so there's fault, there's blame, and people think that that's a reason why there's less need for compassion. And I completely disagree with that, because at the end of the day, we're all human beings. So with a diagnosis, families often experience a sense of grief, loss, and guilt following this diagnosis. However, early diagnosis and adequate information and support for the family can reduce the risk of subsequent children being born with fetal alcohol syndrome. However, many children with fetal alcohol spectrum disorder may become looked after children, mostly as a result of the safeguarding concerns, including the fact that the mother has been drinking during pregnancy. Spare the future child, bottle with a pregnant lady shape. Professional impact. Schools and early years professionals also need to be aware of the condition to ensure that children are assessed and receive appropriate support. However, children often get misdiagnosed of ADHD, as I mentioned before, or not even diagnosed at all and seen as troublesome or busy. For the people who are currently working in schools and colleges, you may have had children in your class where you thought, it's just an annoying child. It is very just a busy child that needs extra support, or they might have the ADHD. And that might not be the case. The child might have been suffering from fetal alcohol syndrome. Yeah, you're right. It is very difficult for the parents as well, as mentioned before. There's still a lot of stigma on there that, for instance, it will be hard to come out and say, well, my child suffers from fetal alcohol syndrome. And it will become it's an extremely difficult conversation to have, yes. And it might be something they will struggle with, and they might have difficulty to say, well, yeah, my child has fetal alcohol syndrome due to circumstances. And the problem is that this is often a conversation they have to have multiple times because of the accompanying behavioral issues that the child might have, that might, due to the brain damage, they might be very impulsive, sometimes break things, and then you have to tell the people, well, he can't help it, or she can't help it, because they have a form of brain damage. And if you want to then also be open, you just talk about the fact that the alcohol was involved. Difficult to discuss with parents, and difficult to because, for instance, after your lovely talk here with me, you might think, okay, I can see children in my surrounding area that have some of these features. It will become difficult as well to discuss this with their parents. You might see it as some of the lovely people here attending are counselor students, and you might see adults who suffer from similar issues. it might be something you can suggest to them. But for children, it will be difficult because you have to have the conversation with the parents. However, it being difficult shouldn't withhold you from actually having a conversation and ask the parent to have a conversation with their GP to see what might be done. If you're communicating with children and young people with fetal alcohol syndrome or fetal alcohol spectrum disorder, few things to note. Fewer distracting information in sentences. Keep the sentences short, clear, and brief. This is A, please don't do this, don't do that. Keep it simple. If you have a sentence where you start and you have a whole conversation, their focus might be gone halfway through the first few words of the sentence. Visual stimuli help as well. In case if you're teaching in a classroom, you might benefit of having basically a calendar of the day. What are you doing? And just having images of, well, this is lunchtime, this is playing outside, etc. Just thinking about the Dutch terms about things you do in the school classes, and they don't translate literally. Provide options. If you ask open questions, like saying, what would you like to wear today? That can be difficult and overwhelming. Rather than saying, what would you like to wear today? Have two items. Say, do you want A or B? What would you like to do today? Would you like to go? If you ask, what would you like to do today? It can be very daunting as well, because the world is a big place and that can be difficult. But if you would say, would you like to go and walk in the park or go to grandma? You keep it simple. Like I said before, children with fetal alcohol syndrome struggle to learn new behavior and new information. As a result, this is an old term, grind in good behavior and structure. If every day you wake up at the same time, you have the same routine, after a while they will pick up certain elements. They know that this morning I go downstairs, I brush my teeth, I put on my clothes, and if you continue to do this structure daily, it becomes a daily routine and they will adapt and follow that. Also keep instructions practical rather than abstract. Focus on the things that they can see that are in the here and now. Talking with children with fetal alcohol syndrome, but children with other disabilities in most cases as well. If you say, well, we're going to go and celebrate Christmas at the end of December, that is going to be such a daunting big thing that they will be dysregulated as a result, because they don't have a clear understanding when that is, how many nights sleep that is, and that can cause loads of confusion. So keeping it simple is often best. Also providing clear boundaries. Just because a child has a disability as a result of the brain damage doesn't mean they would have a carte blanche to do whatever they want. Still promote good behavior. And like I said here as well, focus on the successes. By focusing on the successes rather than saying what is wrong, you will also build their own confidence throughout this. Could the misdiagnosis be linked to epigenetic changes, as in mother didn't know grandmother consumed alcohol and then declared to the GP that no alcohol was consumed during her pregnancy, but the GP is not factoring in the family history? Less so. There will not be a case that a child would then develop full form of fetal alcohol syndrome, but they might have certain DNA traces in the brain that tell them to build a faulty brain, to say that, a broken brain. Good question. Yeah. So this or that. This post. Sorry, Janet.
More likely, potentially, possible?
It is very unlikely because the chances of getting a proper diagnosis is already difficult. And if you were to go after very specific elements in the DNA, you could see it, but then generally you wouldn't. Right. Other questions? Feel free to ask them.
Well, can I just say before the questions, Peter, can I just say thank you so much, because I was sitting here absolutely mesmerized through that presentation, and I'm sure others would agree that there was a lot in there and a lot to take in, but it was really, really informative. So thank you very much. I know Janet had a few questions. Would you like me to read those questions out, Janet?
It might be a little bit noisy. Thank you.
Okay, so Janet sent me a few questions as we were going through. So she's particularly interested in generational impact. She's fascinated by that. How would you suggest we can widen public awareness of that generational impact?
That's a good question. It is an issue like awareness of this of fetal alcohol syndrome is, as you can tell, very low. And there have been several methods done throughout the years that have some impact to try and improve change behavior of people consuming alcohol. There's currently a project going on for the last few years called Make Every Contact Counts, which means that during this training method, if you arrive at any GP, they might ask you, do you use alcohol? And that should be for any meeting. As a result, more people are coming forward with disclosing quite poor drinking habits. And from there, you can work and try to change that. Furthermore, I'm thinking about, I've thought about before setting up an organization as well to spread more awareness about alcohol-related brain damage in general. Yeah. Yeah.
Danielle's got a question there.
Danielle has got a question.
So what is the life expectancy of those with FAS?
So there has not been a study done that shows a decrease in life expectancy. However, there are some issues there because you have people who are more likely to develop problems with alcohol themselves as well. You have people who have difficulty fitting in society. So there will be lots of external factors influencing their life outcome and how long they are expected to live. So it is difficult to say.
Yeah, it's a difficult one really to answer that, isn't it? I think
Yeah.
I know that everybody's really enjoyed it. There was another question from Janet, and then I've got one. I don't know if Gemma's got any for you, but another question is, if you had to prioritize how we educate young people to be more aware, what would you identify as a key priority? And I know that you've included some of those in the presentation, but what else? What would you say is key?
I think making people aware that, first of all, there's no healthy amount of alcohol to use. The amount of times that you hear people say, oh yeah, but a glass of red wine, that is good for the heart. I don't know if you've heard that one. It is often very common. It actually came from a paper that was sponsored by different brewers and wine producers in Europe. And it is basically, you see the paper and then disclosure of conflicting information, and it is almost as long as the entire paper itself. And the thing that is in red wine that is supposedly healthy for your heart is something that you can also find in grape juice, in tea, and a few other items. But by saying, well, this is healthy for you, yes, one element, but the alcohol that is in the wine actually is worse for you than is actually the little element in there. So focus on the structure of the fact that there is no such thing as healthy use. And Yeah, the chocolate and red wine and dark chocolate. So what often happens is that an article gets published by scientists, and that is a very complex topic. And then people who have very little information just take a little bit of information and use that to publish articles. And as soon as one lazy journalist does this, the article gets published and then reprinted everywhere. There is thank you all, Fiona. Good luck with teaching. There's a clear example in America where a research was done to look into bacteria in the gut microbiome, and they looked at certain bacteria and the different type of gases these bacteria create, and the linking of those bacteria with cancer. This was taken up by a article and published in the lines of your farts can tell you if you have cancer, which was not what the article said at all. And then you're a research scientist having published this, and you get calls throughout your whole life with asked questions if you are the fart doctor. Right. So in a similar case where they talk about alcohol being good for you, it is just taking a poorly written article that is then watered down throughout several, like Chinese whispers or whatever the phrase is. I actually have here, I don't know if you can see it clearly, but the harmful use of alcohol causes 100% of alcohol use disorders. It is involved in 16% of suicides, 16% of interpersonal violence, 20% of traffic injuries, 13% of cases of epilepsy, 48% cases of liver cirrhosis, 26% of mouth cancers, 26% of pancreatitis, 20% of tuberculosis, colorectal cancer, breast cancer, and hypertensive heart disease. So again, that is my impact. Also, personal note about teaching: tell the students where the world is and show them a world map, because having taught at a college, having students not knowing where my country was, well, I'm Dutch, which is right next door to England. Make sure that kids in the earlier years learn that as well. But that's just a personal note.
There was just one other question as well that I don't know whether we've missed in the chat here from Danielle. Can I also ask if there's any crossover with other diagnoses? I know we said about the ADHD. Was there anything else, Peter, that you think there's some crossover?
Crossover with that's something. Well, there's other diseases. I think I've talked about it.
Yes, you talked about that earlier on, didn't you, with the Williams?
Yes, exactly. Can't remember where it is, but yeah, there's diseases here. The
Williams, yeah,
the syndromes that have similar symptoms but are not resulting of alcohol.
Yeah. I mean, the other thing that I was going to ask, Peter, is the demographic as well of this type of. Do we know any demographics? I mean, worldwide as well as our own country. I mean, is there any particular areas that are, or is it just completely? And this goes to do with us as individuals and families and etc. Is there any information there?
It occurs more in areas where there's more alcohol use amongst women. The UK is one of the higher drinking countries in the world.
That is interesting.
Not the highest by far, because Russia and Belarus have like an umpteenth, like an exponential higher use of alcohol. But yeah, the problem is quite high here.
Yeah.
And Northern Ireland, yeah, the whole of the UK. Scotland is known within the UK to drink the most alcohol. The northeast of England is the area where there's more deaths as a result of alcohol use. So yeah, there's no area here in the UK where there are not issues as a result of alcohol.
That's interesting as well, isn't it? I just think, and there's just one last question, because I know we could go on, and I know my colleagues are probably the same here, but I know that we've talked about it before when you spoke about with Janet and myself. It's about that actually it's often the mother that is put to blame, but actually that's not the case, is it, Peter?
No, definitely not. It is a mixture of, first of all, society, the idea that alcohol use is normal and that you need to drink to hang out with people. And I remember that there's, when I moved from the Netherlands here, trying to meet up with somebody for coffee seems to be ridiculous, because no, you don't meet up in a cafe, you meet up in a pub. And if you're in the pub, you need to drink. And these kind of things, or measuring the quality of your weekend by how little you can remember of it. And lots of people, lots of cases of pregnancy happen during the time that they might not be planning for it. So they might become pregnant and still have been drinking throughout the first few months. Naomi Wanless, is there much that can be done to reverse fetal alcohol syndrome during pregnancy? No. As soon as it occurs, it is one thing you can do is make sure to stop drinking, but nothing can be reversed, unfortunately. If you have any information relating to Korsakoff-related dementia, I will be very grateful, Elizabeth. Happy to talk about that further. I've published on the topic as well. Feel free to send me an email. My email is listed here, and I'll cut back to you on that.
And I think also you've put a useful slide in with useful links, haven't you, as well, Peter?
Oh, yeah.
So please do check those out.
Yeah. The references.
Yeah, so some really good, useful references there. But please do reach out, and thank you once again, Peter. Thank you on behalf of all of us. It's been a really informative session. But if anybody else has anything that they would like to discuss, please reach out to Peter himself or to us. I think Janet's put our emails in there, because we'd like to support in any way we can. And it might not just be on this topic, but other topics. So please do look out for these events. Although they're called TA events, they are open to everybody. So thank you ever so much, because I know it's difficult on an evening after a busy day. So thank you to everybody, and thank you once again, Peter.
Thank you.